Good morning. I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon. I'm going to talk this morning about rotator cuff tears. So it's Monday morning and you've been exercising all weekend, maybe played tennis, played pickleball, lifted some weights, went mountain biking, and you injured your shoulder. And you're not sure if you've torn your rotator cuff. Well, the top 3 signs of a rotator cuff tear are: number 1, at the time of the injury, you felt a pop. And the pop is the tendon actually tearing off of the bone. So your rotator cuff tendon attaches to your humerus, and when that tears, you can hear a pop or feel a pop. Number 2 is once the injury occurs, you can't raise your arm above shoulder height. You can get up to about here, but you can just not raise it above shoulder height. That's also a common finding with a rotator cuff tear. And number 3 is terrible night pain. Pain that prevents you from falling asleep. Not so much pain that you can fall asleep and then if you roll to your side of the shoulder injury, it wakes you up. That can be consistent with a rotator cuff tear or rotator cuff tendonitis. But with a rotator cuff tear, you just can't fall asleep because your shoulder hurts so badly. So what do you do next? You need to make an appointment to see your orthopedic surgeon. What will happen at that visit is typically they will obtain x-rays of your shoulder. A history will be performed. He or she will ask you what happened, how you feel, what's going on now, and also a physical examination will be performed. Typically, the treatment for that first visit will consist of a prescription for an anti-inflammatory medication and possibly a cortisone injection. And then I will usually see my patients back within 2 to 3 weeks. If it was a tendonitis, the cortisone shot will cure the problem, pain is gone, shoulder's great, you're back to your normal activities. If it's a rotator cuff tear, typically within 5 to 7 days, your shoulder's feeling pretty good, but within a couple weeks, your pain has come back. And on that next office visit, an MRI scan will be obtained. Tune in next week to find out what do you do if you've torn your rotator cuff.